Parents, every other health care experience has trained you to expect long appointments. 60 minutes often of physical therapy, 45 minutes frequently when it comes to occupational therapy, long evaluations, long treatment sessions. So naturally, the longer the appointment is, the more thorough and effective it must be, right? That is why when you watch your child receive a chiropractic adjustment that lasts less than 2 minutes, your brain may immediately throw up a red flag. Wait, that's it? And honestly, that is the right question to ask. But the answer may completely change the way you think about healing. A neurologically focused adjustment is not short because it's doing less. It's short because how powerful the nervous system can respond to precise input. For an already stressed and overloaded nervous system, adding more input is not always better. In fact, too much input can create even more overwhelmed to an already overwhelmed system. Once you understand what's actually happening during those 2 minutes, time on the table stops right then to add value to that adjustment. What it looks like in a very short interaction is actually creating a neurological response that continues for hours, often days after your child leaves the office. This video is specifically for parents who have watched their child move through therapy after therapy, supplement after supplement, and protocol after protocol, but still feel something is missing on the foundational side. Maybe you've watched your child struggle with sleep, digestion, sensory overload, emotional regulation, attention issues, immune challenges, or chronic stress. And maybe you've wondered, could a 2-minute adjustment really make a meaningful difference? This video is specifically for you. In the next few minutes, we're really going to explain what a chiropractic adjustment actually is and what it's not. That's sometimes more important, is what things are not. How a precise neurological input communicates with the brain, stem, cerebellum, the cortex, and the autonomic nervous system. Why pediatric adjustments are intentionally short. Why frequency often matters more than duration of a single visit. And how insight scans help us make nervous system patterns visible. One of the most powerful examples documented within the chiropractic profession happened inside a level 3 neonatal intensive care unit, not inside a chiropractic office. A newborn baby had experienced a traumatic birth. His injuries reportedly included a whiplash type injury involving the upper neck, brainstem, hypoxic brain injury, and a persistent pulmonary issue that impacts newborns. Because this baby was connected to an extensive monitoring equipment and we had to be monitored around the clock, his chiropractic care was very gentle. But his heart rate began to settle, his respiration improved, and his oxygen levels increased. And his entire body appeared to relax and release some of the tension it had been holding. This story is powerful because the monitors allowed people to observe changes that may otherwise have gone unnoticed. In our office, children are not usually connected to hospital monitors while they are adjusted, but we often see their bodies begin to soften. We see breath changes happen quickly. Their shoulders drop, their facial expressions will relax, and parents will frequently tell us that they notice changes in sleep, digestion, regulation, and overall adaptability in the hours and days that follow their adjustment. So what's actually happening beneath the surface? Most people think chiropractic adjustment is just about the pop or the crack, but the sound is not the goal in the least bit. The sound is simply gas being released from a joint capsule. It does not tell us whether an adjustment was successful. The real purpose of the adjustment is neurological. A specific chiropractic input stimulates sensory receptors within the joints, the muscles, and the tissues surrounding the spinal column. These receptors, including mechanoreceptors and proprioceptors, consistently send information to the brain and the body's movement, position, tension, and tone. The muscles located along the spine contain high concentration of these sensory receptors. When a precise adjustment is delivered, it creates a focused burst of sensory information. That information travels through the spinal cord and communicates with areas of the brain involved in balance, coordination, movement, body awareness, regulation, and most important, adaptability. The goal is not simply to move the bone. The goal is to address the subluxation in the nervous system. We described subluxation as a 3-part pattern process. So this is going to be abnormal joint movement and interference in the communication between the brain and the body. For a child, the amount of pressure used is extremely gentle. A common comparison is the amount of pressure you might use to check the ripeness of an avocado. So this is going to be very gentle, it's going to be specific, and it's going to be incredibly precise and the appropriate for the child's age, size, development, and neurological state. A neurologically focused adjustment provides a controlled burst of sensory information that the brain can use to update how it understands and responds to the body. That signal communicates with areas such as the brainstem, and the brainstem is involved in many of the foundational functions that operate every minute of every single day. Some of these functions include breathing, they're going to include heart rate, digestion, when the body is woken up, sleep and wake rhythms, man, those are key. And the ability to shift between stress and relaxation. We call that gas versus braking system. The adjustment may also influence how the autonomic nervous system organizes itself. The autonomic nervous system has two major sides. The sympathetic side, as I just said, is the gas pedal side. It helps the body respond to danger, stress, and demand. And the parasympathetic side is often described as the brake pedal. It supports rest, digestion, recovery, and emotional regulation. Many of children we care for appear to be spending too much time with their neurological gas pedal pressed down. So that's going to be a sympathetic dominant state. Their system may be constantly anticipating the next stressor, the next sound, the next transition, the next food, the next social interaction, the next demand on their nervous system. Neurologically focused chiropractic care is designed to help the brain and the body process sensory information more accurately and respond with greater adaptability. This is why parents may notice changes in areas that initially seem unrelated. Those are going to be sleep, digestion, attention, immune regulation, emotional regulation. We see energy changes and sensory processing. Those are going to be some things that parents typically will see, and these systems are not truly separate. They are all influenced by the autonomic nervous system, so that gas versus braking system. Children may arrive in our office with very different diagnoses or symptoms, but many of them share an underlying pattern that is rooted in nervous system dysregulation. And that's why we focus on neurological foundation instead of chasing each symptom independently. It's highly important to note. A child's nervous system can only process so much sensory information at one time. Imagine the nervous system as a computer that has too many tabs open. When too many programs are running at once, the computer begins to slow down. It freezes, it becomes less efficient, and eventually it often crashes. Many children are already processing an enormous amount of information, whether that's going to be school demands, screens, noisy environments, bright lights, social interactions, food sensitivities. They're going through growth spurts all the time. They're experiencing poor sleep. They may be struggling with chronic illness, emotional stress, not only theirs, but within their environment, so their co-regulation stress, and constant stream of sensory input. Their processing capacity may already be stretched incredibly thin, and adding a 30 to 60 minutes of continuous hands-on stimulation would not necessarily make care more thorough. For some children, it could create the same type of overwhelm parents may see after a long therapy session, a busy school day, a dental appointment, or potentially a crowded social event. More input does not always create a better response. Sometimes more input creates shutdown, agitation, exhaustion, or a meltdown. This is why pediatric adjustments are short by design. We're looking for the most specific input the nervous system needs, not the greatest amount of input we could possibly provide. The adjustment itself may take only 90 seconds to 2 minutes, but the child's brain continues processing and integrating that information so much longer after the visit is over. The adjustment is the input. The integration happens afterwards. Sometimes we do that integration within the office. The most support we need is to not overwhelm a nervous system, is to give it less to process, not more. The brain changes through a process called neuroplasticity. Neuroplasticity is the brain's ability to learn, adapt, and create new patterns. And neuroplasticity depends heavily on repetition. Reps are important. Think about learning any new skill. You do not learn to play the piano attending one 6-hour lesson. You learn through shorter, focused sessions that are repeated consistently. You do not build strength through one extremely long workout every few months. You build strength through intentionally training that is repeated over time, consistency. The nervous system works in a very similar way. Repetition, specificity, appropriate intensity help create lasting neurological change. There are 168 hours in 1 week. Wow. A child receiving 2 or 3 adjustments may spend a total of a few minutes on the table. That leaves more than 167 hours happening between visits. During those hours, the child will continue encountering stress. These stressors include school, sports, screens, TVs, illnesses, poor sleep patterns, sensory demands. We're all facing those. Emotional challenges and growth spurts are massive for them. And the normal demands of childhood. The goal of consistent care is to help the nervous system build and reinforce healthier patterns faster than daily stress continues to reinforce the old ones. The adjustment is truly the catalyst. The child's brain and body perform the integration between visits. This is why we say the magic is not simply in how long the child is on the table. The change happens through the right input delivered in the right place at the correct frequency. One of the greatest challenges with the nervous system is you cannot always see dysregulation by looking at a child. A child may look calm on the outside while their nervous system is working extremely hard underneath the surface. This is why in our office we use insight scans. These scans help us objectively evaluate patterns in the nervous system function. We use 3 primary technologies. The first is heart rate variability, or we say HRV often, surface electromyography, or we say SEMG because that's a mouthful, and thermal scanning. HRV helps us evaluate the adaptability and the balance of the autonomic nervous system. It gives us information about how effectively the body moves between stress mode and recovery. The surface EMG measures patterns of muscle activity along the spinal column. It may help us identify areas where the body is using excess energy, holding chronic tension, or showing neuroexhaustion and fatigue. Thermal scanning evaluates patterns of temperature regulation along the spine. Because temperature is influenced by the autonomic nervous system's activity, these patterns may help us identify areas of imbalance or dysregulation. 2 children can walk into our office with the exact same label and have completely different scan patterns. One child may be highly active and stuck on the neurological gas pedal, and another child may look depleted, fatigued, and unable to amount to an appropriate response in the nervous system. This is why care cannot be based solely on a diagnosis or a symptom checklist. The personalization happens at the neurological level. The scans help us guide the care plan, they help guide the technique selection, and they help us identify patterns of subluxation within the nervous system. And they allow us to track how the nervous system is responding over time. We do not guess. We want to get adequate testing on the nervous system. So when your child receives an adjustment that lasts less than 2 minutes, please remember this. Short does not mean insignificant. Gentle does not mean ineffective. and more time does not automatically mean better care. A neurologically focused adjustment is designed to provide a precise amount of input without overwhelming the child's nervous system. The adjustment starts the conversation. The brain and the body continue the work after your child leaves the table. If your child has been through every protocol, every supplement, and every therapy, but you feel foundationally something is missing, there may be a reason. That missing foundation may be neurological. Your child does not need more labels. They need a clearer understanding of what their nervous system is communicating. To actually learn more about neurologically focused chiropractic care, we highly encourage you to click the link in our bio or send us a DM or schedule directly with our team at Cultivate Health. Get scans, find the foundation, and most importantly, trust the frequency of the care plan. We look forward to serving your family at Cultivate.